let's start with our medication number 1, which is olanzapine here. And what I will do with each medication is I will very briefly talk about the study and then the recommendation grade, and then we will go to that table that we just talked about. Now, let's start with efficacy of olanzapine in bipolar mania with mixed features. And to answer this, there was this study published in American Journal of Psychiatry, published by Tohen et al. In 1999. And this study compared the efficacy of olanzapine versus placebo in patients with the DSM-4 criteria for manic and mixed episodes. And this was also called Olanzapine HGEH study group. And this have total of 139 patients, 17% were mixed episodes. And the study showed that olanzapine was significantly superior in improvement in manic symptoms in both patients with manic and mixed manic features. Episode I should call, because at that point this was all DSM-4 in 1999. And another study did the same thing, published in 2000, efficacy of olanzapine in acute bipolar mania. So there were 115 patients and they found 42% had mixed episode, and olanzapine showed a very significant response rate in both manic and mixed episode. And there was one more interesting point about the second study that we are talking right now. They found that patients who had a HAM-D score of more than 20, which is severe depressive symptom, they had a greater improvement with the olanzapine in reducing depressive symptoms. I know we are talking about mania with mixed feature, but I just thought we should know this because olanzapine also had a good efficacy for the depressive symptoms also. But for mixed right now, very good response in the study. And then we have this post hoc analysis published in 2014. Again by Tohen et al. In Journal of Affective Disorder. So you will see that most of the data is from post hoc analysis moving forward. So what they do is they pull data from prior placebo-controlled studies, and then they look at the mixed feature specifier on those patients, and then they make results out of that. So this study actually had a pooled data from 3 placebo-controlled olanzapine studies in patients with bipolar 1 disorder with manic or mixed episode. And the results were very positive for olanzapine group. Olanzapine was efficacious for mania with or without mixed feature. And as I mentioned in the last study, the greater efficacy was observed for someone with more severe depressive symptoms, which is, HAM-D score of 20 or more. I'm not going to bore you all with details of the study. You can go in the reference section of the PDF of this presentation. And if you're interested in learning more, you can go there. I will put the link of each article. But to summarize this in a table again, for acute manic mixed features now, for monotherapy, the WFSBP guidelines say category of evidence A for manic and C for depressive symptoms, but we'll focus on manic right now. And you know that A category of evidence is equal to either 1 or 2. But you will see that none of the medication received recommendation grade 1 because none of them was meeting good risk to benefit ratio. So the score recommendation grade for olanzapine for mixed manic episode was 2 here. So as a monotherapy, be mindful, we are still in monotherapy. We'll talk about augmentation in a few minutes. So let's go to the table. Where does this 2 score shows up on table? So we have this table here, and olanzapine had the highest one, recommendation grade RG of 2 for manic mixed acute treatment.